guys, and welcome back to another episode of Knowledge or Nonsense. And I am your host, Chimere Curry. And I am so happy to be back today. Last week, if you caught the episode, I didn't have a chance to make it on. And I do want to do a special thanks to Sharon for covering for me. I so appreciate you, ma'am. Today, we're going to have a super awesome show, and I cannot wait. We have a lot in store for you guys. We are going to have Rebecca Lauber on the show, who is amazing. If you guys see her on the social network, she is out there. She has an amazing presence. So I'm so happy to have her today. Woo! Yay for Rebecca. And we are going to be talking about mental health in non-clinical healthcare settings, right? It's going to be an awesome episode, you guys. I cannot wait. One of the things that we are going to talk about in this episode that really means a lot to me is early on, if you guys notice in this season, we talked about kind of mental health. And I talked about how it took me until I was 40 years old to realize that money is not everything, right? And that there was something more important than money. And that was my mental peace when it came to my professional environment. So this episode really means a lot to me. In preparing for it, I did my research, of course, right? And I came up on a study with Columbia University. And they were talking about in 2023, where they did a risk assessment of suicide in healthcare. And what they came up with, which we already know, is that generally in healthcare, the risk is higher, and more specifically in women. And so that was a little bit shocking to me. And then another one of the things that they said was that until now, little was known about the risk of suicide within healthcare. And so, because they pretty much focused on physicians and not so much on the non-clinical portion. And the key thing that I wanted to kind of highlight for you guys in that is that they also noted, I want to make sure that I read this correctly, the importance of increased suicide risk of healthcare support workers, right? Those are going to be those non-clinical workers, guys, was underscored by their growth from nearly 4 million in 2008 to 6.6 million in 2021. And that is a huge number, whether it's 4 million or 6.6 million. That is a huge number specific to non-clinical setting. So I'm really excited to talk about this today because we're going to give you guys some tips and some tools on what that looks like, how to manage that, etc. But like always, before we get into it, I would like for you guys to go ahead, like, subscribe, show us in the comments who all is here, who showed up and showed out for us today, because as you know, we love to see it. And so with that, we are going to take a short break and we'll be right back. Hello, Rebecca. Welcome back, you guys.
Hey, everyone.
Yes, we are here with Rebecca Lauber, right? Thank you guys for everyone who has joined in, for everyone who has tuned in. We appreciate you. Leave your name in the comments, right? Rebecca has more than 8 years of experience in sterile processing and has worked in the industry in almost every role from instrument tech to a manager. Rebecca has a huge social media presence, as I already told you guys, and she is doing great work out here in our industry, and she is very knowledgeable in the field. And I know that I left a whole bunch of things out, Rebecca, so tell us about you.
Hey, everybody. Who all's out there? I'm looking there. I'm looking. Who's all out there? So, my name's Rebecca Lauber. I have Golden Crownie. and LSSGB, so a green belt. And pretty much my journey started. I am an EMT, and I was in the fire service as well. Somebody posted a job about biohazard and SPD, and I said, "Hey, I already deal with that. Let's do it. Let's get on to it." And the rest is history. And I'm still here today, 10 years in the field.
Yes.
And that's pretty much it about me. I love what the work that we do in sterile processing. I love the connection to the patients that we're always connecting with them. And you don't have to be in the room to connect with the patient. So that's something that's going to come across today. But thank you for having me today.
Yay! Thank you so much, and thank you for your work in the industry. I see Tony and Kyrie have jumped on. Thank you guys for joining in and tuning in with us tonight. So look, let's get into it, right?
Let's
We're gonna
go.
jump right into this thing. So, of course, like always, I've done some research.
Mhm.
And one of the things that I came across is we already know, right? Stress starts, well, stress in the workplace can come from a lot of different things.
Mhm.
Um, and so I wanted to know if you can share with us just kind of some of those indicators for burnout. Like, what can people look for in the workplace?
So when it comes to burnout in the workplace, a lot of signs is, people isolating themselves, behavioral changes, their demeanor, how they're
Yeah.
reacting to people. And these are all signs
Yes.
that you want to look for, because when we see those signs, that's the time to really engage with that staff member and figure out, hey, what can we do? What can I do? And what can we do for you to make this easier? Because sometimes it just takes that conversation and that helping hand to make all the difference in somebody's mindset.
The helping hand.
Mhm.
Absolutely. I'm sorry, let me mute my phone here. There we go. The helping hand is it, right? We've been
Mhm.
talking about that all season when we're talking about be the change. Help someone, right? Help someone, no matter how small it is. Help someone. Help someone to get to that next step or that next phase, or to just get over that hurdle, that hump, or whatever it is that's stopping them from being the best version of themselves right now that you can do. Help someone.
Yeah, meet them where they're at. That's what, I'm always talking about. Meet people where they're at on their level and understand what's going through their mind. Because oftentimes we find we can reframe a mindset if we just take that moment to listen. And
Yes.
remember, there's a difference between listening and hearing. We want to listen to them and truly understand what they're going through and put yourself in their shoes.
Absolutely. Absolutely. And I think too that in doing that, you have to start with yourself because there is a restructuring of the mindset. And so you
Mhm.
can either be positive or you can always be in a negative. And that takes work within yourself to make sure that you restructure your frame of thought. And it's hard to be positive all the time. We know that. I understand that. Being a person who used to, in my back in the day before I got older and wiser, right? Um, I had a different outlook on things. And I realized that in working on myself, you have to choose positivity. You have to choose to be optimistic. You have to do that every day. And so it's not like you do it once or twice. You have to choose that every day. You have to choose to see the brighter side of the thing. And so, of course, we go through, but you just have to make sure that you reset yourself and come back and say, okay, I've been through. Now let me get to the other side.
Well, it's always about taking yourself out of what's really getting you in that feeling or in that moment, taking
Yep.
yourself outside of yourself and saying, okay, right, what can I do to change this situation right now? Can I do something to change or do I need help? Because, we're all going, right, especially nowadays, we're going through chronic fatigue, lack of motivation, and especially in our field, that can lead to increased mistakes and reduced focus. And these are the things that we have to look out for, right? And when we
Yeah.
look out for these things, that's when we, especially as leaders in sterile processing, let's take it back to sterile processing for a moment. when we see these things, we can pull somebody aside. But when you constantly see somebody in this spiral, in this moment, that is when you have a choice. You either take them aside and talk to them, or if you let them spiral out, they truly don't feel like anybody's watching out for them. Remember, we're at work 8 hours a day, or even more, depending. So I see my family a few hours a day. I go to work for 8 hours a day, sometimes 10, 12. Things get busy.
Yeah.
And if these things are happening to me while I'm at work and everybody's noticing, but nobody's stopping me, I'm
That,
then going to feel down and like nobody cares. And that could be a contributor to this really tough topic of suicide rates.
and you know what? I'm glad you said that when nobody's noticing. There was a time that I had an employee who was really awesome, really amazing employee. And then all of a sudden, I started noticing a difference in their attendance. I started noticing just kind of a difference in their behavior, like their overall, I guess, vibe was just low. Their morale was low. Increased errors. And so once I started noticing, I said, man, something is going on because this is not like this person.
Mhm.
And so when I pulled them to the side, come to find out there were things going on personally that they were going through, and how I could help was just by doing some minor adjustments. And so, but I had to ask, I had to approach to say, are you okay? Is everything okay? Can we talk for a little bit because you don't seem yourself?
Well, I have a perfect example. So, for a lot of you guys know, I work in New York City. It's a lot of unions and rules and regulations there. And I had a employee whose father had passed away, and a lot of my employees' families are outside of the country, you
Oh,
know. And depending on the culture, they have cultural rituals that they do for these their family members when they pass on. And so, by the book, I couldn't allow, he didn't accrue enough time to be
mhm,
able to go back home
mhm,
and do this very religious ritual.
mhm.
And I asked my boss, can't we just do this?
Right.
And it was like, no, it's not. And I said, you know what? It's going to be up to me. I will take the hit if it
Mhm.
means that he can be at home with his family in the country doing this religious ritual for the passing of their family member. And he was very grateful for that because you don't know what that means. I'm not going to pretend that I understand what that means, because that doesn't exist in my world. But I have to put myself in their world, in their shoes, and understand. And how would it look if I didn't grant them the access? I don't know what that would have done for them.
Mhm. And that's something that you talk about, employee morale, right?
Hmm.
That is something that as a leader, like you said, you can take the hit for that. I can make that choice to make sure in those times of need that I support my team,
Hmm.
right? Take the hit for those type of things, especially when you can. When you're in a situation and you can make that decision, help them. That could
Hmm.
mean a lot in terms of getting through that moment. And that is something that employees remember. And so just imagine had you not said, you know what, I'm going to take the hit for that. Just imagine had you not said that. What
Hmm.
could have happened had that employee not been able to go home, not been able to partake in that ritual? Now they're staying, right? What could that have looked like had they not had that opportunity? I see in the comments that someone is saying mental health is often the elephant in the room.
Hmm.
We see it, but act as if we don't. Why do we do this? And that is a great question. Before I speak, I'll give you the opportunity. Do you have any response to that question?
So oftentimes people don't know really how to confront it, right? So a lot of us we go through life in our own unique ways. We were born and raised a certain way. And mental health, let's be real, is one of the most challenging things growing up. It's
Yes.
very frowned upon to have an issue, to have to
Yeah.
work through something, to have it, especially in men. And I always talk about that during Men's Mental Health
Yeah.
Month in June.
Mhm.
So it's very important that we acknowledge these things instead of saying, oh, turning a blind eye.
Yes.
And that's often people just don't know how to confront that situation, that elephant in the room.
And I would say the same thing to just elaborate that sometimes people are so busy also. So not only they don't know how to confront it, but sometimes we become so busy in our own world that we forget to pick our head up and notice the things around us.
Mhm.
And so sometimes we forget that I'm working right alongside with this person. Like you said, we spend 8 hours a day at work. And between the 8 hours, 12 hours, 16 that we spend at work, our transition to and from work, really the truth is we spend the majority of our life with the people that we work, whether we are working with them or in transition to work with them. And so those become our sub families, I guess I'll call it our sub families, our extended families, right? Our work
Mhm.
family. And
Yeah.
so we have to remember to acknowledge them as well and remember that we are coexisting with them. So sometimes we have to pick our head up. Um, I see a comment here. It says, as a leader, you need to be in tune with your team.
Mhm.
Absolutely. I have several employees dealing with mental health issues, and I have worked to make sure they know they have a safe space to talk about these things with me. Absolutely. Yes, I see you clapping. Yes, to that leader, whomever you are, absolutely. Safe spaces are important because we
Mhm.
never know what people are going through. Times are getting harder. Um, and you just don't know what people have outside. And sometimes because there is a subculture within our department, we don't know what's going on
No,
inside.
no, not. And it's so important to grant those employees that safe space, that open invitation to come in and talk without, do no harm, say no harm. We're just sitting here having a conversation. There's no retaliation against you. Let's just talk about things. What are you going through? Because
Mhm.
oftentimes employees are in fear that if they come and talk to their leader, that's going to work against them, or that leader is going to keep that in the back of their mind when they're, communicating with them throughout their workday. But
Yes,
I know when I was speaking, spoke to you earlier briefly on um, being so hyper hyper vigilant all the time, and that's something
yes,
that's so big right now in the healthcare field, especially with all the shortages, right?
yes,
So with hypervigilance, it's not just impacting our patient care, but it's also impacts the work culture, right? We're always on high alert all the time. And when the employees feel like they're expected to operate at peak performance without rest, their
yes,
mental health just checks
yes.
out. And
And
they
that's
go
one
into
of the
this
things.
survival mode, right?
Yes, and that's one of the things that aids in burnout, right?
Hmm.
So not having the resources. Um, I want to talk a little bit about because we're talking about the organization and the structure about when it comes to the organization. So as an organization, um, whose responsibility is it to make sure that we provide some type of support and some type of help? Does that fall on the department manager? Does that fall on the organization? Does that fall on the person individually? Do you have any kind of weigh in on where that responsibility should lie?
So if you're talking about me, I believe that it's all of our responsibility as humans to take care of each other.
Yes.
So if we're going to talk about, in the human or in the organization, I mean, when you start out, they talk to you about employee EAP programs and wellness initiatives for some places, resilience and mindfulness trainings. I've worked at hospitals as a traveler that have meditation rooms. They set
Yeah.
out days to have like massages and food truck days and stuff like that.
Mhm.
But ultimately speaking, I think when you see something, say something. See something, say something doesn't just equate to when you see something wrong, as in you're seeing somebody do a process wrong. It's also see something, say something. If you want, if you're seeing someone go down a path that's ultimately going to hurt them,
Yeah.
speak up, because you don't have to sit here and say, I'm just gonna pick a random name. Jen, I see Jen is just she's spiraling out. You don't have to talk like that. You just go up to your manager, You let them know, hey, I see Jen seems to be going through a tough time right now.
Yeah.
Do you mind reaching out to her and just, checking in, do a check-in? I love employee check-ins.
Yes. And I like that see something, say something, and you can absolutely apply that to everywhere. I will tell you that when I'm sitting here and you just said that, I said, man, I always think of it as more of a process error, but
Mhm,
you're right. You can apply that anywhere, right? When you
mhm.
see something, say something, and it doesn't have to necessarily have a negative attached to it. Maybe it can be, you can turn that into a positive by speaking up and helping
Yeah.
someone, right?
Yeah, it's not just a poster on the side of this, like the subway train that says "See something, say something." You know what I mean?
Right?
It applies to everything.
Yes,
We have to look out for one another. I mean,
yes.
I can't tell you how many times I've run. Again, we spoke about it. You run into somebody who needs help, and
Mhm.
it could be a simple favor, a simple ask. But that simple favor, that simple ask could mean the whole world to them. It could make their whole day. It could make their whole week, their whole month. But you don't know what your kindness and that simple act that you do does for someone.
Yes. I want to pull Kyrie's she
Mhm.
said made a statement. Can we pull that back up? Okay, Kyrie says, as professionals, it takes all of us to be able to identify the difference in our team members' behaviors and attitude.
Mhm.
Denial can provide a thick cover over one's eyes, and it may be that one friend that can bring you back from a mental health emergency. We need each other. Yes, Kyrie.
Yes.
Yes. Like we are a team. We are a team, right? We are a family, especially when we're, like I said, working together in these departments. We are a family. And sometimes people don't understand. And I tell people all the time sterile processing in itself is a stressful job. And it does not matter what level of role you work in. It is stressful. Just the nature of the job in itself, what we are doing, right, is a stressful job. And the higher you go in that, the greater the risk for stress. And
Yeah.
so I
I
think
mean,
sometimes people in the industry, they make the mistake of thinking that because we are non-clinical, that is easy peasy.
oh, they half of us, they don't even know who we are.
Easy peasy lemon squeezy. And it's not. It's not. And so at the end of the day, what we do really does affect the patient and it really does have an impact on those outcomes. And it becomes a very stressful environment when things are not going the way that that room or that surgeon or even that we intended ourselves. And
Yeah, and
so,
if you don't know how to battle those
yes.
stressors, if you don't know how
Mm,
to react to them and you've never been trained or you never truly understand that scope of work. I mean, I remember, Sharon Green Golden, what she was speaking about how, surgeons yelling, the nurse yelling on the phone, and you have to know how to react to that. And if
mhm.
you don't, and all the alarms and the bell whistles, and I need this turnover and I need this, it's gonna break you down. I'm
Yes.
not kidding. Earlier in my career, I broke down like, why are they yelling at me? You know what I mean?
Right? But it happens. Look, guys, we are going to take a quick break because it is that time. And when we come back, I see you, Tony. We are going to pull that up and make sure that we go over it. So,
Mm.
quick break for commercial and our Be the Change.
Something we heard time and time again was that SPDs really needed a standardized onboarding program.
I strongly feel that losing the connection between the work and the purpose of the work that we do is a key reason why things often go wrong in sterile processing.
One thing that we really focused on in this program is that it needed to be practice-based. People needed to understand what was required in the department, how should they function, what were the steps.
We tried to create this program really linking, here's the task that you have to do, here's some theory behind it, but really here's why you have to do what you have to do.
Understanding the why something is used and how it is used is crucial to connect the dots between the action and our role and patient safety.
And welcome back, you guys. Again, we are talking mental health in the non-clinical work environment with Rebecca Lauber. And if you are just joining in, it has been good, right? So I want to do a quick recap for you guys because we talked about some of those indicators, right? What does that look like? So before we move forward, I want to give you guys some of those indicators. We talked about chronic fatigue, a lack of motivation, increased mistakes and errors, and just kind of overall detachment from the workplace. And so those are some of the things, if you're leaders or even just a regular staff member in your department, that you want to be able to look for in your team, in your coworkers, in, just your peers, to kind of say, hey, I need some help over here. Help me through, right? Now, let's talk about how it hurts the department, because I want to do this in a phase. And so I want to just kind of go a little bit backwards and talk about how it hurts. Hello, Sharon. Thank you so much for tuning in. I also saw Barry as well as I think Kyrie. I think I already said that. But let's talk a little bit, Rebecca, on how it hurts the department. And so can you give us some tools or tips or things that we can look for, how it can impact the department when we consistently overlook those things?
So when we overlook these type of situations in mental health, it often doesn't just impact that person, it impacts everybody around them, right? Everybody feels and is very aware of the situations that are going on. We're very in tune with each other. Humans are very in tune with one another. So they know what's going on. But it doesn't just impact the department, it also impacts, as far as us as colleagues, but it also impacts the workflow, right? So we have SPD is turn and burn. We're always working hard. We're always pushing through things, pushing sets. We have to be on time with everything. 1 minute slower, and it could turn everything upside down. And so when we're not focusing on mental health in the department and that person calls off consistently, we're short. Now everybody else is following through. Now everybody else is feeling that burnout as well.
Yep.
Or picking up the slack. And I don't want to call it slack because ultimately speaking, it's not slack. That person needs help. And I don't want to say that there's not slacking off. They're having a moment and they're basically asking for help and they're waiting to see if somebody will come up and help them, because we don't know what goes on with people day in and day out. We don't know what they're going on in their life, as we've spoken about. So if we're not reaching out and just being that friend, being that colleague, I'm not telling you have to go out and, have the best time of your lives together after work, but just take that moment to reach out, because it's going to impact the whole workflow. And at the end of the day, I get that our workflow is very important, right? Because we ultimately take care of the patients. I know that they don't know who we are. We might not see them, but we are in charge of the patients. But if we're not taking care of ourselves, how are we going to take care of the patient?
Exactly. I tell people all the time, and I tell my staff all the time, I need you. And that is no joke. When I say I need you because there is stuff here we have to process, we have to work. So I want to help you and to be as successful as I can, right? So let's talk about it. Let me check in. Let me make sure that you're okay. I want to can we pull up Tandria Hall? She had something. Can we pull that up? It says, agree, Rebecca, especially as a leader, know your team because they go through things and won't say anything. And sometimes they don't. Sometimes they hold that in. And it's not until you say, you know what, something seems off, or you notice that they're not as talkative or they're making more areas. You say, hey, can we have some time? Let me just talk to you. Let me finding out if they're okay, that it all comes out. And you're like, man, I had no idea that you've been going through a storm and you've just been showing up, just trying your best. right?
So let's talk about it. So I like today, okay? So I would go around different hospitals. I have a lot of hospitals under me, and I was doing mock surveying at a hospital. I
Mhm.
had a new hire. She just took her test on Friday. I thought it was this Friday. Come to find out, when I approached her, she seemed very down.
Mhm.
Um, and I was watching her set up an endoscope in the room, and I said, "Hey, how was your test?" Or, it's coming up, right? And she said,
Mhm.
"Oh, it was last week. I failed." And I said, "Oh my God, I'm so sorry. I didn't know." And in that moment, even though she was already visibly, you can see that she felt down, she
Uh-huh.
broke down. And I said, "Do you want to talk about it?" And she didn't want to speak at the time. And I gave her that grace. I said, "Okay, you come to me when you're ready to talk to me about it. But I'm
Right.
here. Just know that." And what got me the most, what stood out to me the most was that I'm a regional trainer, so
Mhm.
I'm a regional leader. So I'm not
Mhm.
always at the site, but it was her site leadership that wasn't checking in on her.
Yep.
And when I passed by her again, after some time had passed, I saw that she was crying. So I got down on her level. I got down on my knees and I told her, I said, "Hey, what can I do for you? How
Right.
can I help you through this?" And it struck me. She said, "Nobody asked me. Nobody asked me what I could do for myself." And that's what really hit home for her, because I don't know where she was at in her life. We are in New York City, so there's a lot that goes on in this city.
Mhm.
And I don't want her to ever feel that isolation. I saw her hiding in corners, she was crying all day. And I wanted to make her feel like her voice was heard. I said, "Let's set up some study sessions. Let's talk about it." Because the HSPA, they test it tells them where they've gone wrong, or where they're sufficient at or need help in.
Yep.
And I said, "Okay, let's set up a plan. Let's formulate a plan." And I after I left today, I called the other educators around the region, and I asked, "What are we doing for her?" And
Mhm.
that made all the difference for her.
And she won't forget that. It's those things and those kind of conversations that people remember. So people will remember when somebody stepped up and somebody helped them. I see Sharon says, a well placed question or check in speaks volumes. Even as a demanding leader, when I asked the right question at the right time, it served as a breath of fresh air for the person I was asking. Just knowing a leader cared, right? Let me repeat that. Just knowing a leader cared about something that wasn't work related is a game changer. And it is, guys, if you are a leader and you are watching this show, it matters. This Things like this directly affect the morale in your department. And I see Sharon. Can we pull Sharon's comment? She said something about if you have an unstable employee for any reason, you must handle it to keep the other team members sane
Mhm,
because they work so closely together, right?
mhm,
And so if I'm going through something and nobody is noticing, nobody cares about what I'm going through, and I'm carrying that throughout my day, it rubs off, right, on everybody
mhm,
else. You start to feel like nobody cares about me, right? I'm just here. Nobody's paying attention. Nobody cares. Nobody's listening. I'm not being heard. And it can change the morale in the department, right? So I want you to make sure that as a leader that you have a genuine discernment for your team because they matter. They are important. They are the people who are getting this job done. And this job does matter, right? So have a genuine discernment for the people that you are working with to make sure that they are okay because things happen. um, Someone says it takes trust. They have to feel they can trust that you have their best interest at heart.
mhm.
Absolutely. This is all great stuff. This is all great stuff. And I don't know if that person is you again, Barry, but this is all really great stuff, you guys. Right? And so I'm glad that we're taking this moment to talk about how to get through those moments because it really does matter. I do want to take some time. And so we're going to take another break. We are going to do another commercial, and then we're going to talk about our prayer processors. So after this break, we'll be back. Welcome back, you guys. Again, we are talking mental health in the non-clinical work environment with Rebecca Lauber. And so each time I'm being very intentional about making sure that I do a recap. And so if you're just tuning in, we talked about indicators, which is going to be chronic fatigue, lack of motivation, increased mistakes, reduced focus, detachment. We talked about how that hurts our employees, right? And so they're feeling ignored, right? They're feeling overworked, right? They don't have boundaries. They are feeling lack of leadership and mental support. And so these are some things that I want you guys to look for. I want to take a moment to do a quick shout out to our HSPA president, Anthony Bondon, for support, right? As well as creating the program for prayer processors. Can we pull that flyer to the front? Maybe not, that's okay. So we right now have the prayer processors. And what that is a prayer group for anyone who is in need. You can join in on that conference call. And I will make sure that we get a tag for you before the end of the show to get more information. I believe it's Rev A. Bondon, but I will make sure that we get that tag, that we get that posted. So if you need the information on how to be a part of that prayer group, or if you want to just submit some prayers that you need some help with, go ahead and do that. Thank you so much, Sharon, for getting that posted and put in the forefront. If you need this information, please take a picture. I'll give you guys a few seconds. All right. Now we're going to move into how we can help. This is the nitty gritty of it, right?
There you go. Let's bring it.
How do we help? We talked about the signs. We talked about how it hurts. Now let's talk about the actual doing something, right? So what tips do you have for anyone who is watching on how you can help overcome? Once you see it, now what do we do? How do we address this?
So we can set up a plan for them. As a leader, we can set up a plan for them. We can lean into what they're interested in. So let me give you this story, okay? So how I found myself, okay?
Okay.
So I used to be one of those employees, I had a tough time. COVID had hit, going through a bad breakup, and I left Florida, the job I loved in Florida, to just go travel. Okay. But in that relationship, I wasn't allowed to be myself. I wasn't allowed to go do my hiking and my photography in that. And so I had to find a journey through heartache and healing. Right. So, and what I mean by that is we we as leaders need to lean into our employees that are struggling, hear them out, and encourage them to seek peace and happiness with what gives them that peace and happiness, right? So I just want to share how that works for me. And
Okay.
so after the breakup and all that stuff, and remember, it's not just relationships aren't it could be relationships, careers, even how we live our lives, right? We move through them every day as if everything's okay until that one day that it's not. And sometimes it can take years, right? But how I got through that is I leaned into the feeling that I was feeling at that moment, and I turned to something that I enjoyed. So when I left Florida and I went all the way to Boston and I kept traveling up to New Hampshire. And boy, well, I'll talk everybody's ear off about New Hampshire, the White Mountains. I have so many photographs. So for me, it was leaning into that what I love. I love going hiking and I love photography. And it was through that that I was able to feel at peace. So just imagine being among all the mountains, silence, and you're just at peace. It's like meditation, right? So
Yeah,
being in there in the silence, navigating those roads less traveled, and it just makes you question what is really bringing you down, what brings you peace, what excites you in life, and what the best part of the unexplored. And that's
yes.
what I always encourage my people when they're feeling down. I will listen to you. I'll give you a helping hand, and I'll do anything I can. But I always encourage my employees to step outside of themselves and find what brings them joy.
I'm so glad you said that because remember at the start of the show, I talked about it being from within. So
Mm.
you first have to make that choice. And so when you took that journey, it was a choice to say, you know what, I'm going to find my healing. I'm going to find my peace. So understanding what brings you peace. Um, Kyrie said, I'm loving the transparency. Absolutely. We absolutely appreciate that. And I think that it helps people connect the more transparent we are. When we get on the show and we talk about real life situations, it helps people connect and understand because a lot of us are going through the same thing. I can tell you probably everybody that's watching has had an employee
Mhm.
who has gone through something. If you don't have an employee that has gone through something, you are not in touch. I guarantee you, you have an employee who has gone through something.
Mm.
Sharon says, me too, Kyrie. I took a 3-week sabbatical last August just to regroup. I love it, Sharon.
There you
3 weeks, man.
go. Give
Is
me some of that. Give me
is my boss on here? Are you watching?
yeah.
Um, That's awesome. That's a great opportunity. Someone else said, yes, this helps her connect with her team. She is willing to be vulnerable. Absolutely. It's those things. And understanding what your personal piece is, your personal piece, where you can find that space for you to reset, will help you through these moments. If you don't understand what helps you get through, you're going to stay in that spiral for a little bit longer than maybe you should until you figure out what it is that helps me. And
Well,
so,
and I see a lot of people typing in EAP, which is awesome. But also let's say EAP, but let's also talk about all the other amazing programs that like our human resources and our benefits have to offer. Nutritional programs, wellness programs. There's
yeah,
so much out there. And all of those things can provide healing.
yes,
That's it. And if it's one thing that I want to get across to people with all this transparency, is that solitude is not loneliness. The
no,
road less traveled leads to the most beautiful places. And healing is not replacing, it's about rediscovering. And I think a lot of people get lost on those roads and they
mhm,
don't understand, in all of their struggles and troubles and trials and tribulations, that there's peace among all of it.
mhm,
There's peace in just sitting still and just
yeah.
taking a moment for yourself, right?
It is. I want to go back to because a lot of people are talking about EAP.
Mhm.
One of the things that I want people to understand, not just leaders, just people in general, especially our leaders, but just people in general, to know your resources in any work environment that you're in. Right? EAP is a great resource, but know who your chaplain is. What is their contact information? Know the information for your FMLA, for your MLA. What is their contact information? Know what type of hospital programs or what type of work programs they have available for you. And if you're a really awesome leader, who's your florist, right? Because everybody likes flowers, but having that stuff readily available helps you to assist your team. I'm sorry, can you pull that back up for Kyrie? I wanted to read that. It says, I guide team members to utilize EAP, our employer office of guidance and resources. Absolutely. Sharon, I see you said diet. This may be off topic, but if I eat too many King Mike's or hot tamales, I'm so serious, my mood will be off the next 2 days. I just bet it might be off.
Just a little bit.
Yeah, but also, guys, also remember this, that breaking down your requests. So when you have someone who is overwhelmed, maybe it's not a good idea to throw 10 random tasks at them really fast, right? Maybe we want to break that down. Give it to them. When you see that they're going through something,
Simple goals. Simple goals.
chunk that out so it doesn't feel so overwhelming. Offer your help, right? How can I assist you? There's always a way to do that. And then make sure that you offer more praise and maybe not so much judgment because they are going through something in this moment. And when people are going through, what they need is grace, right? What they need is grace when they are going through. Um, it says, here we are. What is this? Sunshine and grounding helps also.
Ain't nothing sunshine can't fix.
The grass. I love it. Put your toes in the grass. Sharon says, offer them thought. Thank you. Offer them the thought of using their psychologist or
That's true.
psychiatrist. I struggle just a little bit, y'all. Just a little bit. Y'all caught me. That comes with the insurance plan. Absolutely. Right? You get free sessions depending on where you are, but you get those sessions. So utilize the programs that are available to you. A little while earlier, we talked about whose responsibility is it to make sure that these programs are available. And while it is an individual thing, I do feel that as a leader of the department, it is on us, right? Because I am that leader that feels that I take a certain level of accountability for my team. I want you to be successful. I want you to be happy, right? When you're going through, I want to be a resource for you. And so, as a leader in my department, I want to make sure I know what those resources are. What is the number for EAP, right? Do we have a program to help you when you're going through? I want to be able to offer that for you. So, for me, it's the organization, right? To be able to offer those things. And then the next level is my department. My department leadership is where we are so that we can offer those resources.
So, and I always put those in my orientation documents, right?
There we go.
In that
Yes.
orientation,
Yes.
right out the gate, give them the information, let them know what's available to them. I can't tell you how many jobs that I worked that they never told me the resources. I'm like, wow, I could have, everybody's offering, psychologists, psychiatrists, just like Sharon says, they're offering better health, mental health, fitness, free nutritionists. Who wouldn't love that? But if we're not telling our employees the resources that are available to them, then we're doing them a honest disservice, right? We're supposed to be looking out for them. And I mean, I know I can't tell you how many times I've heard, oh, we ain't family. No, we're family. I mean it. You're my family. Okay, you'll always be my family, even beyond.
Yes. I see Tony says, my team calls me Miss Resourceful. Sharon Green says, yes, Rebecca, share with that employee one-on if accepted your way of dealing with mental health events. Yes, yes. Sharon Combs, let's see. I believe it is the leader and the person. Absolutely, absolutely. That's what I was just talking about. It's the leader and the person. We have to take our own accountability, but leadership teams have those resources available, right? Speak even if the leader does not ask. Your mental matters, and you have to value it even when others don't appear to. We need and want you here. Please talk. Absolutely, absolutely. We have just enough time to do one small break. And then when we come back, Rebecca, we're going to talk a little bit about where people can find you and what
Um,
you have going on right now. I know we talked a little bit early, so I'm going to hold it in just a little bit. We're going to take a quick break, you guys, and we'll be right back.
Be the change.
Be the change.
Be the change.
That's right.
Be the change.
Be the change you want to see.
Hi, I'm Latoya Chapman, and I am the Director of Education for GSPA. I am making this video to accept and participate in the challenge of Be the Change that you want to see. My goal is to guide as many people as I can into being the great leaders that they can and want to be. We all have had somebody along the way give us a gentle nudge towards our greatness, myself included. I am striving daily to facilitate an environment of learning and sharing knowledge for all. This is how I plan to be the change that I want to see.
Be the change.
Be the change.
Be the change.
That's right.
Be the change.
Be the change you want to see. Thank you to my team over at Wellstar for accepting the challenge to be the change. And we are back, you guys. Before we go, Rebecca, can you tell the people how to reach you and a little bit about the work you're doing with rare disease?
So you can find me here on LinkedIn. That's mostly where I hang out here. So you can find me here. I work in the city. So if you need anything, I'm also in New York City, HHC. That's where I'm at. So, but just reach out to me. I'm open. I love talking to people. I love connecting with each of you. I talk about anything, willing to learn about anything or anyone.
Absolutely. So before we go, guys, this was an awesome episode. I appreciate everyone who joined in. I appreciate all of your comments. Please spread the word and continue to show up and participate and show your support because we love to see it. And I promise you, Sharon, I are really appreciative of all of your support. I do want to say that there is never a wrong time to do the right thing. And before we go, I just want to let anyone who is listening, who may need the information, sorry, excuse my dog, who may need the information, or if you know someone who may need that information, that the suicide hotline number is 988. Pick up the phone, dial 988 for the suicide hotline number. If you need it or if you have a crisis, that is also a resource for you as well. Let me let that sit for a little bit. So you guys can take a picture. And until next time, you guys, I want to thank you so much again for everyone who showed up. Thank you, Rebecca. This was an awesome show. I really appreciate your time today. You are so welcome.
And I wanted to I sorry I didn't answer your other questions. So some of the work that I'm doing right now with rare diseases.
Yes.
Sorry about that. So February 28th, or when we ever have the 29th, is Rare Disease Day. I have a very rare disease. I'm 1 in 500 in the world with my own disease. And about 7,000 people with rare diseases are affected in Americans. And then, so I want to challenge everybody who is listening here today. Go to rarediseases.org and please find one rare disease, research on it, advocate for it, because a lot of my life's work and everything that I do for sterile processing and in healthcare, my whole purpose in life is to ensure that the people who are fighting for a voice and fighting for their lives and for support is seen, they're heard, their voices matter. So all of my life's work, all of my fundraising is for these people, especially the children as a rare disease patient who had this since I was a child. So please go on raredisease.org, find a rare disease, and advocate for it. I appreciate you guys for giving me this platform to say that.
Thank you so much. As a mother to someone who has sickle cell, and I find myself in this field constantly advocating for those patients, I want to tell you that I personally appreciate the work that you are doing, because I know that my son will benefit from that as well. So thank you so much for all the work that you are putting into that.
Well, like I told Sharon, and I know I told you earlier today, no matter, so, this is personal, so y'all getting some personal stuff from me real quick. But my disease is will never get better, right? But my philosophy in life is, as long as I can continue to move and as long as I can continue to speak and advocate, I will be the voice for those who cannot. So please join me in being the voice for them as well.
Absolutely. Thank you so much. You guys, we are out of time. Until next time, thank you so much for everyone. Thank you, Rebecca. Again, this was an amazing show, and I appreciate everyone. You guys, see you next Tuesday, same time, same place.
See y'all.